Hello everyone, I am Dr. Apoorva Suran. Just like all of you, I have been dealing with diabetes. In my case, it's been through my role as a board certified endocrinologist. I have seen many patients who are dealing with diabetes. I have shared their views, their thoughts, their triumphs and challenges while dealing with diabetes. So today we are all going to discuss a very important topic, that is the role of diet in managing diabetes. I know that is one question that every patient of diabetes asks the doctor. So today we are going to embark on our journey of food. We'll explore the food choices which we have, the important and the healthy choices which we can make so that we can live a healthy and happier life together. Imagine you are in a buffet at a party and you are seeing a full diversity of meals in front of you. And you have put everything, whatever you like on your plate. Just pause there and think about what is going to happen next when you eat that food. So our body is a miracle. As soon as you eat the food, the body utilizes that food, converts it into a simpler form of energy and uses that form of energy as a fuel to perform the day-to-day activities. That fuel and the simplest form of energy is known as glucose. So how does that glucose enters the cells and releases energy? There is an organ called pancreas which is located in the back of our abdomen, just behind your stomach. It's a very small organ. As soon as you eat food, it springs into action. It releases a hormone known as insulin. And insulin, you can consider it as a type of key. A key which can open locks, a lock to the cell. So insulin is the key which opens the lock for the entry of glucose into the cells. And these cells utilize then glucose in the form of energy to perform day-to-day activities. Now in diabetes, there is a hitch in this process because either the keys are lost or the locks are very rusty. So we know there are three kinds of diabetes, broadly speaking: type 1 diabetes, type 2 diabetes and gestational diabetes. So talking about type 1 diabetes, here the keys are lost. There is no insulin in the body, not at all. In type 2 diabetes, the keys are there but the locks are too rusty to open. And in gestational diabetes, it actually happens in women who become pregnant, and it's a temporary kind of diabetes usually. But it does leave a very high risk of getting converted into type 2 diabetes in future, both for the mother as well as for the baby. So it doesn't matter which kind of diabetes you are suffering from, because the food plays a starring role in all of them. Because it is the medium by which your body converts food into fuel and uses it for energy. Now imagine your body as an orchestra and food as a sheet music. Whenever you eat a balanced diet, your body orchestra plays a beautiful symphony. While if you eat out of proportion meals, then this beautiful symphony can change into cacophony. Similar thing happens when you eat a diet which is not balanced, a diet which is full of trans fat, saturated fats, high sugary drinks. Definitely that will lead to increase in the blood glucose levels. So food has 3 to 4 kinds of nutrients in it. Broadly speaking, there are carbohydrates, fats, proteins and fibers. Carbohydrates take the center stage in diabetes because they have the direct impact or the deepest impact on our blood sugar levels. But they are not the villains in our story. They definitely have a deeper impact as compared to the other nutrients. We need to balance the right kind of carbohydrate with proteins as well as fats and some fiber in our diet, so that the excursion in the glucose levels in our blood can be reduced. So fats and proteins, they reduce the absorption of carbohydrate in our diet and reduce the spikes of glucose which occur once we eat a high carb diet. Fibers on the other hand directly does not impact the blood sugar levels but they definitely reduce the pace at which the carbohydrates get absorbed. So, eating a balanced diet which is low in carbohydrate or moderate in carbohydrate, high in protein and healthy fats, and high in fiber definitely leads to a good control of blood sugar levels. Now let's talk about portion size and meal timing, which are two very important characteristics of food and while you manage your diabetes with food. So portion size is very important. Imagine that you are in an orchestra and all the musicians are playing the music together. What will happen? Will you hear a beautiful music? No. There will be a lot of chaos. Similar thing happens when you eat a large amount of food at the same time. This causes a spike in your blood sugar levels and your body dysfunctioning. So it's very important to eat the right food, the right type of food at the right time and in appropriate portion. So let's talk about the dietary guidelines which are present in managing diabetes. Consider them as a roadmap which can lead you to a healthy and happier life. When you talk about the dietary guidelines, a term which comes to our mind is the glycemic index. So glycemic index of the food is defined as the rate at which a food increases the blood glucose level in your body once it enters the bloodstream. So there are foods which have high glycemic index. It means that they increase the blood glucose level to a very high peak in a very short time, and then there are foods with a low glycemic index which cause a gentle increase, a steady increase in the blood glucose levels. Imagine them just as you are on a roller coaster. So high glycemic index foods are the ones which are like imagine you are on a roller coaster. Foods with high glycemic index can be compared to the rides with steep slopes, and foods with low glycemic index can be compared to the rides with gentle slopes. They are resembling the rate at which your blood glucose levels peaks and then troughs in your blood. Then there are food items which we should know we have to avoid when we eat in any time in the day. Those foods are your sugary drinks, foods which are very high in trans fat and saturated fats. Whether they are cola drinks, they are fried items, they are baked items, they are all bad because they are with high glycemic index. They raises your blood sugar levels at a very high rate and also crashes them soon enough, so that the glycemic variation in your blood is very high, which can lead to further complication in diabetes. But I want to tell you that it's not the same for every person. You cannot plan a meal and just give it to all the patients of diabetes. Every patient is different. Their food preferences are different. Their lifestyle is different. Their food choices, their day-to-day activities are different. So you talk to the practitioner, health practitioner, the dietitian near you, who can help you guide and make a plan of a diet which you can easily follow for the rest of your life, because diabetes is not going to go away. So it's important that whatever changes you are making, that can be sustained throughout your life so that you can lead a healthy and safe life. And remember, it's not that you have to be perfect. It's just making progress one step at a time. Now let me give you a sample plan. So a sample diet plan for the day. Let's pack our bag for the whole day. So for breakfast, what would be a very good option would be a bowl of oatmeals sprinkled with cherries and some berries and some nuts. So oats are a good source of fiber, low GI food, very low carbohydrate. Cherries give you some taste, some sweet taste, and some antioxidants as well. And nuts, they will provide you with healthy fats, again with antioxidants. For lunch, we can try a grilled chicken salad with lot of veggies, with a drizzle of olive oil and a whole grain roll alongside. So chicken, we know, is a lean protein, high in protein, and olive oil is again a fat, but then it is high in unsaturated fatty acids and good for heart. The whole grain roll is again low in carbohydrate and will be good for your satiety as well. Let's make grilled salmon for dinner along with some steamed broccoli and some pinch of quinoa. So broccoli we know is good in protein, low in carbs, a low GI fruit, a vegetable, sorry, and quinoa is again a high protein grain with a low GI index, and salmon will give you a lot of protein. Also, we have to do some snacking in between, that like any of us would do. So for snacks, what would be really good option would be some almonds, a fruit. Fruit will be rich in fibers. Almonds will give you fats as well as carbs, but all in right amount, and antioxidants as well. Here I would like to tell you that I really think that what you should do is you should plan your meal ahead for the week, because in last minute you will end up eating all the high carb and high sugary food items. So let's not do that. Let's plan your meal for the whole day so that you can enjoy your meal. It's very important to enjoy your meal as well. So we don't want our patients to suffer, to overthink and to think every time what they eat. So it's a very good strategy that you plan your meals ahead and then you can enjoy your meal as well. So as we come to the end of our journey, let's look back at whatever we have discussed. So firstly, we discussed about the type of diabetes, all three types. We discussed how food impacts the blood sugar levels, the role of pancreas, the role of insulin, how insulin is the key to the entry of glucose into your body. And then we discussed about what are the different macronutrients in your food items, be it carbs, be it proteins, fats and fibers, the role of carbs in increasing the blood glucose levels, the role of mixing and balancing your food with the right amount of carbohydrate, protein, fats and fibers. We also discussed about the glycemic index of different food items, how foods with high GI should be avoided and how foods with low GI index should be included in your diet. So here I would like to give all of you a very important message from my side. What I feel whenever I see a patient in OPD, there is a lack of awareness of diet control, both in patients as well as the clinicians. In our busy OPD, sometimes we don't have enough time to guide our patients about the diet. So I would like to tell and to request all the clinician friends of mine from this platform that please spare 2 to 3 minutes of your appointment time with the patient for discussing the right amount of diet which you can have in a day, or you can send the patient to a dietitian if that facility is available in your hospital. Because what I have seen, people with difficult to control diabetes get controlled when they are given a roadmap to a diet plan. So it's very important that we balance the diet as well as we ensure the compliance to the therapy of diabetes. So as we wrap up our journey, I would like to invite you for further future adventures. If you are interested in hearing any health related topics, especially rounding around diabetes or anything regarding endocrinology, so I would be happy to share. If you like the video and if you feel that it is valuable and others can be benefited with this video, please hit the like button and subscribe to our channel so that we can know that you are listening and getting benefited. Also, we would like if you have anything extra to comment or anything to share, how can we improve our information delivery or anything, any topic which you want to hear from me, I would definitely be happy to acknowledge your request.